Healthcare organizations are drowning in data, yet struggling to unlock its potential to improve patient outcomes. Our next guest, Daniel Blumenthal, is transforming this challenge as VP of Strategy at MD Clone. With nearly a decade of pioneering synthetic data solutions, Daniel possesses a unique perspective bridging healthcare innovation and data privacy protection. From launching MD Clone's North American operations to establishing partnerships with leading health systems like Intermountain Healthcare, he's witnessed firsthand how synthetic data can democratize healthcare insights while safeguarding patient privacy. Driven by a passion to turn data into actionable intelligence, Daniel shares MD Clone's revolutionary vision to enable safe, collaborative discovery across healthcare ecosystems worldwide. Join us to discover how synthetic data is breaking down barriers, accelerating research, and empowering healthcare professionals to ask better questions of their data. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Daniel. A big welcome to our podcast today. I'm so excited to have you on.
Thanks for having me.
Well, given your extensive experience launching MD Clone's North American operations and establishing key partnerships with healthcare organizations across the U.S. and Canada, plus your unique background building startup ecosystems and supporting entrepreneurs through your role as Deputy Counsel of Economic Affairs at the Government of Israel Economic Mission in Chicago, I am really excited to have this conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Daniel, it's almost time for our community to learn how you and the MD Clone team are pioneering healthcare data innovation through synthetic data technology that enables safe, privacy-protected collaboration across healthcare ecosystems worldwide. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
What a great question to start with. I'd say that innovation, the work we do in healthcare, maybe especially, it lives or dies whether people trust it, trust what we do, trust it enough to use the innovation, use the technology, use the services that we're deploying. And if you focus on building trust just as much as you focus on building solutions, building technologies, you can really change the way, in our case, healthcare is delivered, patient lives are impacted.
That's a big term to think about, trust in healthcare, because it is true. I mean, it is really, really important. There's so much innovation, so much technology, so many new shiny objects that are coming at these healthcare decision makers, no matter where they're at in the ecosystem, no matter where they're at in the industry. So you're 100% spot on, right? At the end of the day, this is healthcare. This is touching personal lives across this nation. How are some of those ways that you tactically do that, Daniel? Are you bringing these customers along for the journey as you guys continue to build MD Clone? Are they part of the process? What does this look like to build trust with these leaders across the industry?
We're introducing new ideas, really novel concepts in how to handle patient data. The concept of synthetic data is, especially when we started 9 years ago, it was pretty much brand new to certainly the healthcare market. And when you're building that sort of innovative technology, bringing that to the market, you have to find partners. You have to do it with trusted leaders in the field. And so our ability, and it was really what a fortunate way to launch our work, was to work with some of the leading researchers, the leading scientists, the leading health systems in the US and globally, and proving out what we did, not first by bringing it to market, but first by building it with the market and showcasing that we could build data that was worthwhile, had meaningful value, could be used for novel research, could be used to impact the way systems were delivering care. For us to tell that story is one thing. For our partners to tell it is a whole nother. From day one, an important aspect of how we've brought our solutions, brought our technologies to the market.
What a great perspective and kind of peek into the organization that you're helping lead at MD Clone and how it came to be, what you guys have done in the marketplace with these partners to bring these new novel ideas to an industry that, again, has had so many things come at them, and that building that trust layer in regards to these new innovations is so paramount and key to move our industry forward. Of course, we're going to unpack all of these things, what synthetic data is, how you guys are building it, what does it mean for the industry, what is it going to do for the future of the industry as well. We're going to discuss all of this and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Daniel Blumenthal, VP of Strategy at MD Clone. Daniel, thank you so much for joining us, and thank you for setting the stage on the front end. Building trust with these new innovations that we're seeing come into healthcare, so important, right? There's this notion that if we're going to move healthcare, we're going to do it together, from technology to innovators to the established healthcare system. It's going to take all of us to get there, and building those trust mechanisms, those trust layers between all of those stakeholders, so paramount. And of course, you guys have brought new ideas and new novel technologies to the industry that is doing exactly and all of this. So got to talk a bit about how did this all come to be? You've now been with MD Clone for a little over 9 years now. Incredible notion to celebrate being with an organization that has been so innovative for so long. That's awesome in and of itself. So we'll talk a little bit about how that came to be. Then, of course, we got to discuss, how are things going today? What is MD Clone up to in the market today? And then where are things heading next? What do we need to be thinking about as folks tuning into this podcast? Where's the industry heading? What should we be mindful of? And of course, where is MD Clone going to be in that future state as well? And of course, can't let you get out of here until we figure out ways to help you and the MD Clone team out. But first, Daniel, take it back. I know we mentioned it before we hit record. A number of years ago, you were helping the varsity basketball team at Northwestern, and now here you are as an executive of one of the leading health tech innovation companies in the industry. Can't wait to hear how this all came to be. Why healthcare? How did you get into it? Give us a little backstory of how you became an executive at MD Clone, and then we'll discuss current state.
Sure. Well, I have to say that it's hard to imagine that anything will quite compare to the exact intensity of being on the court at a Big Ten basketball game in a timeout or in a locker room with your team and 10, 15,000 fans cheering you on. That has a level of intensity that is hard to match. But the startup world is close. And the pace at which we move, the way in which we are certainly interacting with so many different people, organizations, and all the time reacting to the market, and at the same time trying to be ourselves, trying to take our ideas, take our innovations, take our vision and showcase it. So that journey, it's not a straight line for sure. For me, it's been all about engaging with really smart, really talented, really driven people, and finding this group of innovators at MD Clone who had a lot of experience in the healthcare ecosystem prior to launching MD Clone. Our founders and many on our team in the early days especially had been in the healthcare industry for a long time, been dealing with healthcare data, patient data, challenges with access, challenge with sharing, challenge with learning from patient data. And now we're able to put all of the talents together, put all the ideas together, and build something new, exciting that we can bring and transform a new field. So it's an exciting path, not a straight path, but an exciting one.
So how did they find you, or did you find them, now almost 10 years ago? How did that come into view?
Being in the right place, right time with the right people, and maybe some talent, maybe some luck. Certainly, I was able to connect with the group of people who, as I mentioned, had been around healthcare, founded some previous companies. I was working with the Israeli government in Chicago, trying to promote different technologies across lots of different sectors of the Israeli startup ecosystem, and got connected with a particular person, Ziv Ofek, who had founded a company now about 25 years ago. And his company had been acquired. Now it's more than 10 years ago. And he was looking for something new. And we stayed in touch. And a year or so later, he had come up with this concept for MD Clone and asked me to join. And since day one, have been really integrated with that really smart, talented group of people. And on we go.
I would definitely say it always seems like a blend of, luck, being there at the right time, but of course, smarts. I know you had one heck of a successful journey thus far, 9+ years at MD Clone. Obviously, you're doing something right on a personal level as well, Daniel. Let's talk about current state. Let's bring it back to today a bit and talk about who is MD Clone and what are you guys working on today? As you know, lots of things have changed even in the past, 5 years. We had COVID. We were seeing the speed of innovation just moving faster and faster with all kinds of breakthrough ideas and technologies. So let's start there. Who is MD Clone?
MD Clone is a company all about how do we turn data, make it accessible in efficient and safe ways so that we can learn, we can build, we can deliver better care to patients. We can impact the lives of patients. And what we've seen is that there are so many barriers to leveraging the tremendous amount of data that we've collected over the years. And we've invested as an industry a lot of money, a lot of time in collecting data, more and more and more. And yet, if we think about how that data has been utilized for generating new insight, generating new services, generating new tools, it's a fraction of what's possible. So MD Clone is all about how do we make access to that data more efficient in a safe way. And in doing so, what can the market do? What can innovators do? What can startups do? What can researchers do? What can analysts do? What can physicians do? What can nurses do? What can administrators do with that information? So we build tools and approaches to leveraging that data, turning it into meaningful insight, turning those meaningful insights into better care.
Let's also talk about, you know as well as I do, let's just call it what it is. It is difficult to innovate in healthcare. I've been at it for, 2+ decades now. It's not easy. And there's some reasons why, but then there's a lot of reasons of, hey, this is how it's always been done. Status quo, right? Orthodoxy. It is challenging to move healthcare forward. Let's just call it what it is in regards to innovative and new technologies. So let's discuss that for a bit. What are the biggest barriers that you and the team have encountered when trying to convince healthcare systems to adopt this notion of synthetic data solutions? And how has the market's perception of synthetic data evolved since those early days at MD Clone?
Biggest question we get, the most challenging question we get from day one until today is, does it work? And the idea of synthetic data is an example of how can we make data more accessible in a safe way? How can we take patient information that has been collected and that we need to protect the privacy of for so many reasons? We as institutions, when we collect data, we're trusted to protect the patients in many ways, protect the privacy of patients. And yet we hold this asset, potentially so much information that can improve care, improve lives. And this ability to generate synthetic data as a mechanism to protect privacy and yet maintain meaningful utility in data allows us to make that data utilizable by so many more people and so many more solutions. But the question comes back, does it really work? Does this mechanism of generating synthetic data, generating what you can call fake data, does it actually build data that has meaningful utility? Can I use it to run an analysis? Can I use it to build a machine learning model? Can I use it to learn retrospectively what happened to a population of patients? Can I use it to predict something that's going to happen in the future? And on the one hand, I get the question, does it work? I get why people ask it. When we show synthetic data, when we first introduce the concept of synthetic data, it's out there. It's sometimes hard to conceptualize. How do you build a new populations based merely on statistics? How do you generate meaningful data, meaningful information based on a series of numbers and that's it? And when we show the granularity that the synthetic data maintains, people ask that question, and we have so many studies at this point. So many, as I mentioned earlier, so many leaders in research industries, science industries that have demonstrated the utility of the synthetic data we generate. And yet it seems like no matter how many times we do that exercise to validate the synthetic data, you go to a new institution, they want to see it themselves. They want to test it themselves. They want to play with it themselves. And that definitely becomes a barrier. And it's, on the one hand, understandable. And on the other hand, challenging and frustrating from times. But we're definitely seeing growth in the field. We're definitely seeing more interest in the field. And that makes us excited for what's to come.
Well, healthcare is known as being a skeptic bunch. Let's be honest and half joking, but half truthful. But that's okay. I understand why we have to be. We're talking about healthcare and the health of patients and the folks that we take care of. But let's go there. Let's talk about those success stories. You guys have had a number of them. Let's look at one of them, particularly with Intermountain Healthcare's chronic kidney disease program. You guys saved over $7 million annually in working with them. So with that, how do you guys help healthcare organizations like Intermountain measure the ROI of implementing synthetic data solutions, and what metrics matters most to these executives as you do this work?
It's another challenge, no doubt. On the one hand, we're bringing an innovative concept. On the other hand, if you're running a health system, it comes down to the bottom line of, are we improving care delivery to patients? Are we improving outcomes? For sure. And often, fortunately or unfortunately, are we saving money in doing so? Are we able to maintain our operations under strict budgetary constraints? And so there's a series of ways to demonstrate the ROI. You mentioned the great example of our work at Intermountain, where the organization had the desire to better care for patients with CKD, with chronic kidney disease. And when you just sort of peel back the onion a bit here as to what is the challenge in taking care of this population of patients, what you start to realize is, where do you start? You have, at a place like Intermountain, more than 100,000 patients. This was back then, well, more than 100,000 patients with CKD in the system. How do you start from that big number and figure out which patients can we have the most impact on? And how do we prioritize the right patients at the right time? Make sure that we're intervening at the right time. And that question ultimately comes down to being able to navigate your data, being able to find the interventions that are most meaningful, find the patients that are in most need of those interventions, and then actually take an action. And that's a huge orchestration. And so definitely the way in which we are measuring ROI could be, in that case, can we develop a model that is going to allow Intermountain to better care for those patients, to better identify the patients at most risk, and to hand that information into a workflow that they can use to actually pick up the phone, call a patient, get a patient to see the right care provider, get a patient to follow up with the right test at the right time. We see ultimately that having an impact on the bottom line, on our patients crashing into the ED at lower rates, our patients more likely to maintain their current medications? Are they more likely to have their lab tests up to date? These things all matter to the bottom line of an organization, especially an organization like Intermountain. So whether we're deploying those sorts of solutions and actually seeing savings to the tune of quality of care or bottom line budgets of organizations, or whether we're enabling organizations like Intermountain to take that data and partner with other research organizations, other health systems, tech companies, could be life science companies, in a safe way, be able to discover on top of that data and find new ways, treatments or different technologies or different therapies that could be delivered. Those are all measurable ROI back to an institution like Intermountain, whether it's, again, savings, whether it's partnerships, could even be publications that come out of it, showcasing the work that's being done and being able to share that information. That's meaningful impact to a place like Intermountain.
Yeah, and what an unbelievable organization, Intermountain, in and of itself, right? They are so cutting edge and so innovative. So to be able to partner with a health system like that, incredible work, Daniel. Thank you for highlighting that work there. Of course, moments ago, we mentioned this notion of how fast technology innovation is coming to healthcare and kind of the speed of which it's happening. One big thing right now that we're seeing is this kind of takeover, if you will, of AI into healthcare. So let's go there for a bit. I know you guys have introduced what you guys call Adam's Copilot, that it can assist with data preparation, visualization, and data mining insights. So with all of that in this fast moving sector of technology in healthcare, all things AI, if you will, how do you and the team see generative AI transforming the way healthcare professionals interact with their data, and what safeguards are in place to ensure accuracy?
What an exciting topic, what an exciting question to be asked. We talk about this a lot. We're at a moment in the world, a moment in time that we're so lucky to be a part of, where all of a sudden in the last couple of years, we are able to do things using generative AI technology, using the compute power available to us. We're able to do things that we just couldn't feasibly accomplish just 2 years ago. And all of a sudden, we're able to process data in ways that allow us to build new solutions, build new models, learn from data in ways it would have been inconceivable just 2 years ago. And all of a sudden, we're starting to deploy new approaches. So just some examples that we could think about. How do you turn the automation that we see from AI? How do you turn that on inside healthcare? And one of the biggest challenges that we're faced, that AI faces, is that it has to learn from data. It has to learn from information. But if we're in a world where the privacy of patient data has to be protected, how does an LLM learn from patient data? And if it can't learn from patient data, we can't trust it to implement it, certainly not for automation inside healthcare. It's one thing to use it for email writing. It's one thing to use it for office processes. It's very different to use it to automate the dosing of a medication, to automate a clinical trial enrollment, to automate a prior authorization. Very manual functions today that could very easily be automated via AI. We're not talking about replacing physicians. We're talking about taking just heavy manual labor that isn't necessarily leveraging the smarts of a physician, the smarts of people who have been training for a very long time, but things that could not only increase efficiency, but certainly quality of care delivered. Being able to do that, again, this wasn't possible before, but in healthcare today, it's still not entirely possible because access to patient data is limited. If you insert now synthetic data, you all of a sudden open possibilities to learning from patient data without risk to patient privacy and generating large enough volumes of patient data needed to learn from. It's really important to recognize that no one has enough data. No one has enough data to learn in a specialized enough way about these populations in medicine. The number of very specific lung cancer patients, even at the largest system, even at the Veterans Administration, the largest health systems in the country, just not enough data at these institutions on very specific disease types, on very specific care pathways. Being able to use synthetic data to generate information allows us to build the assets that are needed to AI to be developed in ways that it is in a way hard to imagine, but really exciting to see coming to fruition.
Yeah, Daniel, you're spot on. It's amazing just what has happened in the past 24 months. It's almost hard to even fathom and think what's going to happen in the next 24 months. It's moving that fast, and it's just so many breakthroughs. It seems like almost monthly now, and it is. It's an exciting and humbling time, and it is quite an honor to be at the forefront of all of this in real time and watching this and shaping it and helping lead it in this industry that, again, touches all of us. It's an honorable thing for many of us and quite the privilege indeed. So thank you for sharing that. Of course, Daniel, we also need to look a little future state as well. Think about the next 5 years and looking forward, and as healthcare continues to embrace this notion of synthetic data. Matter of fact, there was an event in 2025, Synthetic Data Summit, that's gaining momentum. With these types of things happening and this momentum occurring behind this movement, what do you and the team see as next major breakthrough or application for synthetic data in healthcare? And how is your team positioning itself to lead in the space?
I already mentioned the need for AI, for LLMs to be trained on top of more and more data, and patient data being so crucial to be able to learn from. And I think that just continuing with that theme, the ability for us to process data now more than ever is on people's minds. We start to understand the value of having accessible data. And all of a sudden, MD Clone's solution becomes that much more important, that much more impactful. And one of the initial concepts of MD Clone, if we came to the market and said to a group of physicians, to a group of researchers, here's data, what question would you want to ask? And when we brought that forward, we thought at the beginning that you would have all these curious people with a boatload of questions that they've been just clamoring to ask over the years, that they've been blocked from asking because it was too hard to access the data, or the data was blocked away with privacy regulations, so on and so on. And all of a sudden you ask the question, what would you want to do? And what ended up happening more often than not is you get some sort of glazed over eyes. You would get people who were stuck a bit. How do I ask my question? How do I really get to interrogate data? And I think one of the things that AI is doing, and one of the things that it's positioning us for, is being able to help people ask better questions, help people explore, and unlocking the curiosity of really smart people. And doing that in tandem with AI now makes it all the more necessary to have access to data. Now makes a solution, now makes the approaches that MD Clone brings to market with synthetic data, now makes that efficient and safe access to data that much more important. And we are really excited for what's to come when you have an industry and people all across the industry ready to ask questions of data, ready to engage with data, ready to train AI, as I already shared, ready to use data to impact the way we deliver care.
Well, you mentioned that you guys are passionate about helping others ask these questions in regards to interrogating data and being there to be that helping hand in these new and exciting times. Well, let's talk about helping you and your team. What's one problem, need, or question that you and the MD Clone team have that our community can be helping you with?
I think it really builds off what I just shared. What is something you would do if you had your hands on robust patient data? If in front of you was a large populations of real row-level patient data. When I say row-level, I mean what look and feel like individual patient records with medications, with labs, with diagnoses, with demographic information, potentially with social information, with cost data, with financial data. Robust information could be structured data, could be unstructured data. If you had that at your fingertips, what would you want to do? What questions would you ask? What solutions would you build? And the more people who bring forward those ideas and who share what's possible, the more excited organizations who are collecting data will be to making that data available, so that together we can change the way we are building solutions to impact patient lives.
Oh, I got to imagine there's a lot of folks out there that would love to have these conversations with you. Daniel, how do they get a hold of you and the team? What are some contact points online, social media handles, websites, or otherwise? How do they track you down to have these exact conversations?
mdclone.com and Daniel at mdclone.com. Best way to get in touch, and really excited to engage with your listeners.
Well, easy enough. For our listening community, just simply scroll on down into the episode notes from where you're accessing this podcast. There will be these contact points for Daniel and the MD Clone team. Of course, you can head over to our free global online community over at passionatepioneers.com. There will be a post for Daniel's episode with those contact points, and you can leave comments, suggestions, and feedback or otherwise, again, over at passionatepioneers.com. Daniel, what an incredibly exciting time. You guys are leading this charge and this notion of synthetic data and all the incredible opportunity that can unlock for so many of us trying to advance and working hard and bringing healthcare forward. What an exciting time. And thank you so much for sharing all of this today. But before we let you out of here, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because?
I'm a passionate pioneer because we have so much potential to turn data into insights and turn those insights into improving patient health.
I love it. I love it. Way to bring it all together at the end here, Daniel. Again, thank you so much for taking the time to be with our community today. I know you and the team are moving and moving fast. You guys are working your tail ends off and building one heck of a company, but thank you for taking a time out to be with our community today. We really appreciated your time. And again, Daniel, wishing you and the entire MD Clone team the ultimate best success as we continue to work together to move healthcare forward. So for now, thank you again for being with us today.
Thanks, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.